So welcome to the first of the Generation Active sessions. So thank you for joining us. This one is Play On, Connecting Communities Through a Physical Activity Ecosystem. So this session was born out of the Play On campaign, which I project manage. So I'm Neve Ben-Roberts and I'm from UK Active. The campaign itself focuses on family activity and connecting families to their local activity offer within their community. So very much focused on the many touch points within a community where we can encourage families to get active. So things like their school, their GP surgery, their housing association, pretty much anything that's going on in their community that can support them to be active. So the session itself will kind of explore these themes and look at a few of the touch points. One of the kind of key things that I think we thought was really important with this session is kind of looking at the impact of COVID and the lockdown and how that's affected families living in communities at the moment. And obviously communities aren't feeling that connected at the moment as they've been quite separated. So one of the key things is looking at the spaces and places that are available in communities where families can be encouraged to, supported to, and supported to be active really. So I'd like to introduce our panel. If I could hand over to Jill first to introduce herself, that would be great.
Hi everyone, good to meet you. I'm Jill Rothwell from the Children and Young People Directorate at Sport England. My role today is to talk about the value of families getting active together and to share some insights that we've discovered through our Families Fund. Jamie?
Hi, good morning everybody. I'm Jamie Dickinson. I'm Group Head of Social Value for Places for People, which is
Jamie, very, very sorry to interrupt there. Your audio is just very quiet.
Sorry, is that any better?
Yeah, that's perfect.
Sorry, my apologies. Good morning everyone. Jamie Dickinson from Places for People. I'm Group Head of Social Value. So my remit is around community investment and improving health, etc. outcomes.
Jamie, sorry to interrupt you again. I think your audio, when you place your device on the table, it might cover the microphone. So maybe try and lift it up slightly, it might work.
Sorry, is that any better?
It's a little bit better, but it's still very quiet.
I might try and dial out and in again if
That's all right. We could start with Laura.
Hi, I'm Laura Tiernan. I'm a primary lead PE teacher at a school in West London, and we're trying to encourage, or we have been encouraging our families to use our site as an opportunity to be active as individuals, as parents, and also with their children as families, and supporting that across the board.
Perfect, thank you, Laura. Nina?
Everyone, I'm Nina. I work for the Olympic Legacy or the Olympic Park. They have about 5 different names that people know us by, and it is my role to look after the community sport and outreach that happens across the park and East London. I guess for today, a particular focus on, as Neve said, stuff in response to COVID and how we use the park as a mini active city to get families and people in the local area using and engaging with us.
Perfect, Bogdan?
Hello everyone, pleasure to meet you. My name is Bogdan. By background, I'm a doctor, which is why I'm really excited to be here, because it's my day off hospital, my only day this week off hospital, because I'm working over the weekends. So it's a pleasure to be here with you guys. I wear a few different hats. So I've been working throughout COVID on this emergency kind of rota. So hopefully I can share some insights in terms of what we've seen kind of from the front door in A&E as well. But my other hat is doing a bit of education for the younger generation, as well as setting up the NHS England Social Prescribing Champion Scheme, as well as the International Social Prescribing Day, which you've all, I think, been part of celebrating on the 14th of March previously as well. But I'm a big believer in the biopsychosocial model of disease and model of healthcare, and you'll hear me talking about that a bit today. But I'm also a big believer in the younger generation and in change that can happen at an early age. So hopefully we'll talk more about that in a second, but thank you for having me.
It's great to have you here. And Jamie, go back to you now.
Hi, good morning. Sorry, hopefully that's better. Good, marvellous. Sorry, for the third time, Jamie Dickinson, Group Head of Social Value at Places for People. my role is largely around community investment and improving, amongst other things, health outcomes in our neighbourhoods. Interestingly though, and I think Place for People is slightly unique in the housing sector, in that we're also one of the largest leisure centre operators in the country as well. And again, part of my role is to try and be the glue that brings different parts of the business together. So bringing housing and health together is a really, really interesting challenge.
Perfect, thank you all. Just before we kick off with the panel, I've got a short video to show.
So everyone can learn to ski, and instead of cars, we ride bikes everywhere. My name is Tan, and I'm 10 years old, and snowboarding.
Sorry, 1 second, the sound's just not working. Try that one again.
How I would make my active community, I would every time you do 10 sports, you add you build a bit of a water slide to the local swimming pool, and also instead of if you're gonna do work on school on Fridays, you just do sports all day. Hi, my name is Megan. I'm 8 years old, and my favourite sports are trampoline and gymnastics and swimming. A fun fact about me is that I love flying fossils. I like to do things like be an astronaut. I think that would be really good in cars and that stuff is that we can have just like or speakers or anything, but they have lots of different speakers, and so that everyone, if they want to listen to them, they could just pedal along together. That would make it almost faster. Maybe faster. Tree climbing. I wish I could do that every day. If I had a tree right in my room, I would climb, and I could climb it to get down my downstairs. Oh, that would be a dream. We would go to a park. There could be free trampolines, and they could just be active anywhere.
Were you setting any challenges from school?
Virtual sports day and training to be astronaut. We had challenges. My name is Rona Cooper and my age is 8. My favourite sports are football, tennis, skiing, swimming and mini golf.
Excellent. And do you have a fun fact about yourself?
I'm funny.
Okay.
Every time you go in the shops, you go on your bike.
Okay, so more bikes. What, does everyone have to have a bike?
Yeah.
Okay, would you do anything else?
3 apples every day.
3 apples every day?
Yeah.
Why would they need that?
Because they need to stay healthy. I'm Jude, and I'm 4, and I want to show you my jump.
You like PE? Tell me something else about you.
I like watching football, playing, talking, jumping. I want to jump right now.
Okay.
Jump with. I would like to go there.
Where?
In my garden, silly. Let's go to the park right now.
Would you like to? What would you like to do at the park right now?
Ride my bicycle. My name is Henry Cooper and my age is 7. And my favourite sports are football, skiing, tennis and swimming. I like to play and I like to play. I will make my community active by adding more stuff so more people can go anywhere. Swing and climbing walls.
Anything else you can think of that make it a better community?
Zip lining?
Good zip lining.
Yeah.
Is it for just the children or for the whole family? Do you think would be good?
Everyone. Because they can get stronger, healthy.
Thank
And
you.
I'm gonna add more food stalls so they can get eaten.
Good eating.
Hi guys, so some good food for thought there. Sorry about the video quality and the slight sound issue at the beginning. Technical difficulties will be the death of me, but hopefully we're better positioned now. So yeah, we wanted to kind of kick off with some ideas from children and young people around what they would like an active community to be. Bikes seemed a popular choice there. But in terms of kind of looking towards the panel, I guess now. So Nina, it would be great to kind of talk a little bit to you about the Olympic Park as a mini active city. So if you could tell us a bit more about how activity is encouraged on the park and how you encourage kind of families to use that as their local area, that would be great.
Hey, sure. It's madness actually. We're saying the other day we're coming up to our 10-year anniversary since the Games in London, which is incredible. But yeah, so I don't know how many people know the Olympic Park. So a bit of context, we are based in East London and across 4 boroughs, which are, to give you context, Newham, Hackney, Wigan Forest and Tower Hamlets. And I guess the idea pre-Games that we're creating effectively a new piece of city in the east part of London, and my role within that and the team I work within the Regeneration organisation is looking at how we, I guess, create the best situation for local people to ensure they can access opportunities, to ensure that the opportunities that exist are in line with what people want. And then my specific role in that is, as Neve said, trying to encourage sport and activity and outreach. I guess we've changed what we're doing now. When we first reopened as a park, we were about mass activity, about getting people active, about using the motivations of the Olympics to get as many people as possible out and using spaces, and very successfully that's happening in a lot of parks we see across London and across the UK now. And we've changed our approach a bit more, and now it's about really targeted outreach and about how we use sport as an outreach tool to connect with the people that probably wouldn't necessarily identify with the open space that exists around them. So a lot of our work now is around co-creation and working with local organisations to help them deliver on the park as opposed to us being kind of the delivery body. So we work with the likes, just to name a few, so Bikeworks, Badu Sports, E20 Football Foundation. So these are really locally grown organisations from around East London, and it's about them, I guess, encouraging how they'd often describe disenfranchised people and often young people to encourage them to use the space. And the way they talk about the park is really lovely, actually. They're like, it's the optimum for a lot of the young people. Often these are people that haven't left their borough or left the mile radius that surrounds them, and bringing them to a place where elite sport happens and you've got kind of world-class facilities is a way for them to have ambition and to be involved. But and I guess we do that in 3 different ways. We have our core weekly programme that we run and work with said delivery partners, and that's just free activity that anyone can turn up and use and get involved with. We always have a programme of uplift around school holidays, specifically targeted at families and young people. We have our youth board and the organisations we work with that encourage us to talk about the activities they want. So actually, in response to COVID, we're just starting this week to run a summer programme working with the detached youth teams across the 4 boroughs. So we had some instances, I'm not involved in the Olympic Park, but the surrounding parks and the boroughs where some young people had some injunction orders in place and there just weren't activities happening. So we've been working with the young people and providers in the area to actually provide a safe space on the Olympic Park for them to begin to run some activities again. And then we're really lucky we've got great assets like the venues. We're just about to launch our rowing pontoon, our water sports pontoon. We have the London Marathon Community Track. We've got great green space, and for us it's about getting local people to help us create programmes of activity that they want. And as I keep mentioning, kind of the idea of how we use it as an outreach tool, where we're really hoping that through engaging in sport we can then offer people other opportunities within our education programmes, within our skills and employment programmes, and these are often people, as we say, that wouldn't necessarily want to be engaged with other activity. And then more recently, actually, how we use the park as a bit of a pilot space and to test new ideas. So there's lots of stuff happening around the active travel agenda, and I know that lots of children on that video spoke about cycling and using bikes and looking at how we create kind of free routes for activity. And then I guess the biggest impact we often find is how we use the major events that happen on the park as a way of leveraging some more activity. So we have in place with all of the major events providers that they have to have a community outreach plan. And for us, that is vital for engaging people with either the venues that wouldn't necessarily be able to afford tickets, and then ensuring there's a legacy that comes with that event. So each of the providers will have to work with us to provide either a 12 or a longer week programme of outreach within schools and being delivered on the park. So that gives you, I mean, in a roundabout way, a bit of a taste of the different things that are happening. And I know we'll speak a bit later about how you can get involved as a provider or how you can get involved as a family. But yeah, so I guess the main points on that is that we work closely with the major events. We kind of have our core programme activity, but I guess our main thing over the last few years is to see that co-creation and how we work closely with the groups to deliver kind of activity that they want. But yeah, we'll talk a bit more about that in a little bit, I'm sure.
That's great, thanks Nina. I think it's really nice to see the kind of way that you're linking in with the local community and seeing the way that it's been built from the ground up but with them involved, and I think that's really important for them to feel that ownership. Jamie, it'd be great to kind of link you in on that point, as you invest a lot in kind of regeneration in areas, and I wondered whether you could talk a bit about whether an active community is something that you look to support in kind of regeneration projects.
Yeah, absolutely. I mean, interestingly, we're partnering with Balfour Beatty to do a lot of the development within the Olympic Village, so there's there's a natural tie in there. Yeah, I mean, it's interesting how it feeds, and I think Nina picked up on the point that either implied or explicit, but it's not just about the activity itself, it's some of the other opportunities that arise from that, because health and its wider determinants. I mean, just was your question, Neve, sort of why we do it or how we do it?
I think a bit of both. Why is it something that you think is important? And then is it a case, I guess, whether Nina says of linking into those local opportunities?
Okay. Okay. So yeah, I mean, the way that we actually approach any sort of investment, whether it's a health and wellbeing agenda or anything else, is to work. We sort of taken a step back and we thought we were quite grown up about it. And I don't think it's massively innovative thinking, but there's a traditional model, certainly within social housing, that it's quite sort of paternalistic, and we deliver to people. And we're sort of in charge, and then we get some quite unwieldy, big and very expensive teams to deliver all this stuff. And I think going back about 4 or 5 years ago, we realised that a more sort of community and social infrastructure investment approach was the right way to do it. So that's about getting involved and building partnerships with often really sort of hyper-local organisations, because they are the organisations. I know this is a sort of an old-fashioned term, but of and for that community. I think, but it might be an old term, but I still think it's really, really valid here, because those are the organisations that tend to be community-led and are most in touch with the communities and what the needs of that communities are. So our role is to support, embolden, raise aspiration, build capacity within that sort of social infrastructure within a particular neighbourhood, so that they can actually do the work that needs doing rather than us intervening. And I think intervening is probably the right word there. So I suppose that's the how. In terms of why, without getting into corporate speak, but you know, places for people's vision is places that work for everyone, and sort of what sits underneath that is sort of a loose concept of sustainable neighbourhood. And that sustainable neighbourhood isn't you know, purely an environmental term. It's about financial stability, resilient communities, equality of opportunity, and health is and well-being. You know, as a corollary of it, is a building block of that sustainable neighbourhood. So we do it because, you know, again, without being paternalistic and getting into the intricacies of what the role of a social landlord is, but where I don't think we have a specific role to play in direct interventions in the health and well-being of our customers. We have a role and a responsibility to put in place the things that enable customers or residents to take that on board themselves, if that makes sense. So building that infrastructure and doing it in the understanding that it will improve health outcomes and other outcomes in that community. And from a purely business point of view, if we improve those outcomes and we build that sustainable neighbourhood, it becomes sustainable for the business, because you see, you know, real key business indicators affected. So, you know, things like that local ASB, antisocial behaviour rates, things like relet times, things about, you know, rental income, all those things are, if not a direct result, but certainly a tangible result of investing in those sorts of activities.
Thank you, Jamie. Yeah, that makes complete sense. I mean, you're improving the community, so of course that's going to benefit everyone involved. Laura, actually, it would be great to bring you in on this, as schools are obviously places that sit at the heart of the community. So your thoughts on whether you think the school is a good community setting in which to bring families together, and how you've encouraged and kind of fostered family engagement with the school.
Yeah, sure. We're lucky that we've got a good relationship with our parents. We're in a large community. We've got about 86-87% live within a 1 mile of the school. So where we've sort of worried about active travel in the past, we know lots of our parents walk. We were looking at barriers and trying to find out what stops our parents coming through those gates to be interactive with us, with the children, and to be active themselves. So the first thing we looked at was things like bike racks. The kids talked about the scooters and bikes, and everyone's craze going on of how they could have their scooter and how they could decorate it, but no one ever parked it. The parents, they scooted in, but they took them home again. And it's like, well, hang on, that's the first barrier, that they're carrying it to the shops or wherever they're going next. So we looked at bike and storage rack, and we were lucky that a local company was doing a bidding system, and we put in a bid, and we went from 3 to 6 bikes being stored a day to, during an active travel session of the big pedal, to 140 of bikes and scooters. And we thought, okay, the kids like it, they love it, so why would we stop? So we invested and we put more opportunities in, and we've got so many children scooting in, and the parents laughing behind them going, well, they make me walk faster. It's like, well, yeah, that's your good, that's your health. She's like, well, yeah, I can walk further and I can walk faster. And they've kind of built their own little active community within themselves at the same time of meeting in the park and stuff. But with our family learning, the established relationship we had meant as soon as you can put an email out to parents, but they don't read it. You can put a flyer out and they don't read it. And it's not because they don't want to, it's just there's so many other things going on in their schedules that it's just the last thing they want to do is another piece of paper. but we used a sandwich board, and I just stood at the front as the PE lead. I teach every child in the school, so it was just, I'll stand here with a sign, the children will read it, the parents will read it at the school gate, and it was just a quick win of action. So we did a healthy active lifestyle 8-week session where we looked at balanced diet and how diet, lifestyle, mental health can improve the health of the family together. And that was well attended, and we did cooking sessions with them. We went to shopping, Tesco's, with the children and the adults to write the shopping list of what we needed. And it was really, the kids love being active with their parents. If you've ever done a circle ball, if you've thrown the ball around and one person has to run around the outside and beat the ball, for the children to see their parents and their mums and dads being competitive, to not want to lose to another child or another mum, it was brilliant. And it just got them being active as best possible. So just using our school site, we're lucky with playgrounds for Key Stage 1 and Key Stage 2 separate, and a field. We've got the capacity to be able to bring those families in, things like when you do the Sport Relief Mile. That was brilliant. Everyone turned up at 3 o'clock all dressed in red. We got the kids out, the parents that were there. We'd already done one as a school of every year group, but to have a parents one with the children coming, the children were really proud that their parents were taking part. And also the parents were quite chuffed with themselves that they managed a mile around the school, even if they were doing 5 or 6 laps of the whole facility. The most recently successful thing we did, and the idea came from a networking session done by London Sport, and a head teacher went, I've got these amazing facilities, and at 3:30 they're empty. They might be an after school club until 4:30, maybe 5, but then there's nothing. Like, why? No, everyone goes home. They don't really want to go to their local park if they're not sure about it, or if they're not 100% sure of the just community of where they are, if they're new to the area. So we tried it the second week back in September last year. Sport England had done a funding poll out, and our local area, which was Let's Go Southall, had put out information to say if anybody wanted a bid. So we did the idea of a stay and play for 2 options. One, after school, we did a launch week of the Key Stage 1 playground being open, and as all but 2 year groups out of the 7 leave through that playground. So I was there 5 minutes before the bell, a bag of equipment and all the sort of playground equipment behind us, and just said, stay and play. You've got till 4:30, stay with your parents, stay with the kids, and just play, use it as a park. And by the end of the week, there was family sharing picnics. There was, I think the max we got was 85 in total, which just as a one day, everything was sort of 60, 70, 80. But when it hit and the deputy head, like the SLT were coming out, they were playing basketball with the children. It just created this social side that was so beneficial for the parents to be able to interact, but for the kids to play on the equipment and just use as much as they could, often as they could for that week. It was so successful that the parents came and tapped on the shoulder, was like, we'd like this each week, please. So we did it for 10 weeks all the way through till October. And the plan obviously was to do it again for the summer term, but COVID slightly got in the way for that. But it will be something we'll try and manage even within our bubbles when we go back in September, because we know it will be beneficial for our children socially, mentally, as well as physically to be out. And then the last parental community was for the younger children and the parents that had younger than school age at 9 o'clock. Neve, have you got the pictures up there possibly to show? Because the picture's just so much better than my words.
Yeah, I'll just pull those up.
The idea was that at 9 o'clock I would be, or just before, or 8:45 to 9, I'd be at the front of the school with a parachute laid out, using it as a mat, and our children and the parents could then, you can see at the top left, that we just sat with equipment and the parents stayed, and it gathered into sort of a momentum of every Monday from 8:45 to 9:30. The parents just sort of sat down with the children, and as the weather sort of deteriorated a little bit, if you look to the right hand side, we used our hall because it was always an empty space on a Monday morning, and we looked at ways they could play. You can see hopefully that the parents are interacting with the children. It wasn't just them sat on the floor. We interacted the idea of healthy fruit, and the children with the love of strawberries and grapes and melon was just fantastic. So yeah, and the bottom left is one of our stay and play pictures as well. But it just, we gave the opportunity for that safe environment, and I think the school offers that. We've got the space, we've got potential staff similar to myself and other members of staff that are available in those time slots in the mornings or the after schools, just to really harnessing as much as possible the time that we can offer and the capacity to do things. It does really make a difference.
Thanks, Laura. I think I completely agree with you there. Those schools are the hubs that sit at the heart of communities, and they're already connecting families anyway. So it makes complete sense to build on that. Jill, it'd be great to bring you in here kind of around that active role model piece that Laura mentioned. So looking at maybe why Sport England created the Families Fund and why kind of it was something that you thought was valued to invest in that family activity piece.
Sure, thank you, Naeem. Well, the Chief Medical Officer recommends that children and young people do an average of 60 minutes a day of moderate intensity activity across the week. And we know from our Active Lives Children and Young People survey data that 53% of children and young people in England, that's 3.8 million children and young people, are currently not meeting this threshold. And our research tells us that families, and in particular parents and caregivers, play a key role in shaping a child's attitudes and behaviours, and this is particularly relevant to sport and physical activity. Parents and caregivers can provide support and encouragement, but they can also add pressure. They can share their own sport and physical activity passions, but they can also share their fears. They can facilitate access to various opportunities for children to be active, but they can also limit options. They can model active behaviour by taking part with their children, but they can also model sedentary behaviour. And we want our investment to support families on low incomes so that the children have positive experiences and develop the confidence and competence to be physically active. Many of the current opportunities are aimed at children taking part with other children, with parents sat on the sidelines. And we want to build on this. So we've invested in 44 different types of organisations to help us test it. These include local authorities, larger children's charities, small voluntary sector organisations, and some traditional sports sector partners. We focused on low socioeconomic groups because we know the inequalities are starker there. And the organisations that we've invested in already have direct links to these type of families. So we're eager to learn how to get them active together. We know from our Active Lives Children and Young People data that enjoyment is the biggest driver of physical activity in children and young people. And from our last Families Fund data report, 87% of young people aged 8 to 16 and almost all children aged 5 to 7 agreed that they enjoyed doing physical activity with their family. And 93% of parents agreed too. We're beginning to see impacts on family communication and relationships too. More than 86% of adults and young people in projects agreed that being active as a family brought them closer together, increased the amount of time that they spent together, and helps them to enjoy being together more. And finally, more than 70% of adults and children and young people agreed that being active together helped them to be more open and honest when talking to one another. And more than 80% of adults and young people agreed that it helped them to support each other.
Perfect, thank you, Jill. I think it's very clear to see that family activity is hugely beneficial for, I guess, both children and parents. So it goes both ways, which is really, really nice and explains a lot about why we're here, why we're looking at family activity and why we want to look at those benefits. Bogdan, it would be great to kind of talk to you a little bit about social prescribing, as I know it was recently included in the government's new obesity strategy. So clearly there's a bit more focus on kind of the benefits of social prescribing and why it's something, why it's something that we think is important now. It's also something that kind of embeds physical activity and the health sector together in a community. So it would be great to talk to you a little bit around social prescribing, and especially now that it's kind of moving towards a focus on children and young people, and a bit about why you think that's important and beneficial. That would be great.
Absolutely, yeah. So first of all, can I just say that Laura and Joe, I've really enjoyed the fact that you're kind of developing intergenerational activities. And I think that's a big kind of important key to the local communities. I mean, I think everything is intertwined with what Jamie was saying, the economy with everything, and healthcare are kind of like linked together. So I think it's really important that if we make a change, we make a kind of like a 360-degree change. And I'll talk a bit more about that in a second. But I get this question a lot at conferences about, it's kind of traditionally social prescribing, or all these activities are associated with older people. And that's because lifestyle changes. We kind of think that it's because, those who are already, affected by disease need to make these changes. But actually, we need to realize that the young ones are at a stage where we could mold their behavior and develop these habits early on, and develop them in the first place so that we prevent disease from occurring in the first place. I'm a big fan of the obesity plan. I don't like the fighting obesity kind of terminology. I mean, I'm a big fan of kind of being careful with language. So I'll talk a bit about that in a second as well. But I think when you consider the biopsychosocial model of care of disease, which is what personalized care is based upon, essentially proving that our health is not just influenced by biology factors, but also psychological and social, it seems that we tend to neglect or don't think as much of the social and psychological aspects of the younger people, although we should. And here's the important bit here. During the COVID-19 surge in A&E, I've never actually seen higher rates of self-harm, higher rates of mental health related presentations amongst those below 18. So I've had 6 suicide attempts in one night on my on-call shift, and that's just one of the days that I've had. When you ask these kind of young people, what's happened is they kind of like lost their connections within the community. They've lost their group friends, their friend groups, and they've lost that kind of link. Now, even without COVID, mental health is more and more prevalent amongst the younger generation. And we live in this highly digitalized world, which should really connect us, but somehow it just paradoxically distances us even further. So we need to ensure that the younger generation have spaces to play in, activities to counter stress and isolation. And I currently work on a gastroenterology ward, so I see several patients who are admitted on a weekly basis, not because they're unwell biologically, but because their social and psychological circumstances are at stake here. So I see alcohol excess, which could be supported in the community, or I see anxiety and eating disorders, which could be dealt with by having a strong local connection and a safer environment for these people to meet others who've gone through the same issues. Now, my big belief is going a bit back again to the intergenerational activity, is that we can actually bridge that intergenerational gap by involving the younger generation in elderly patient activities, and get them to kind of liaise with each other and work with each other. We know that this brings up a bi-directional kind of like learning process, whereby the younger learn from the elderly, but also the elderly kind of have that revitalizing, kind of energizing kind of feeling because of the younger kind of population being around as well. But I think there's a common issue here, because interestingly, if you were to ask me how we are approaching this problem and how easy for us to talk to patient about this, and I think this was one of the reflection points as well, but basically, if you were asking me how easy it is for me to talk to patients about physical activity, we live in the 21st century, and this is such a no-brainer question. And again, paradoxically, because it's such a no-brainer question, something really funny happens because we neglect it. It's such a basic thing, physical activity, that when we discuss it with patients, here's what happens. It's kind of, you have a patient, let's say Mrs. Smith, and then you start your conversation and you ask, do you stay fairly active, you'd say? And the patient just says, well, not as much as I should do, but, and then you kind of just counter in and you say, well, but it seems like you've been told off already for this, so I'm not going to bother too much with this. And then, so next question, so do you smoke? And then they say, yes, I actually do. I've been struggling with this for a while. Okay, but you've been told off already, and you know the importance of not smoking as well, do you? And then they say, yes. Okay, next, alcohol. So you see, because we don't think we have the time, we just basically assume also that these things are so basic and so easy to kind of sort out, and that we don't spend enough time talking to our patients through it. And I think this is the problem of, you know, the culture that we've been building in medical school, but also that we've been building in schools, and how we train our doctors and our medical students, because we're traditionally being taught to tell patients what to do. And so when I teach social prescribing, when I go to conferences, I always get a lot of GPs, a lot of doctors who say, well, actually, I always tell my patients to exercise. And so, you know, you can tell them as much as you want, but do they actually do it? How do you ensure local communities are built in such a way that they promote these activities? So this is the big kind of problem that we've been working on, is to change that kind of paradigm shift and to change that culture around how we teach others in medical school, because we're taught to react to disease. So we're being taught in algorithms. If high blood pressure, prescribe antihypertensives. If diabetes, prescribe metformin and insulin and all those kind of, you know, drugs in there. But we know the evidence for physical activities is out there, yet, you know, we don't place a big emphasis on teaching future doctors these things. And I guess you can argue in secondary care, the problem is that it's an acute scenario. So you have to kind of, you know, patch the problem up. And I kind of, whenever I teach students about this, I kind of think about it as a big bottle with kind of like holes inside it. So the NHS is a big bottle that's kind of like leaking from loads of points. In the acute setting, what we're good at is picking up a plaster, patching up a hole, and then there's another hole that's leaking like the next day. And that's the problem. We are reacting to problems rather than trying to go to the root of the problem, which is deeply rooted within our kind of nearby communities. So this is why I'm a big believer in education, and that education is actually the biggest barrier to person-centered care. There's a lot of papers out there to say that time was the biggest barrier that we're facing as doctors. And I always argue that that's not the case. If you want to invest some time during this consultation to do something that's going to last for a longer period, it's an investment of that time into preventing that patient from coming in several times in the future. Therefore, if you know what you're doing, you can actually save that time in the future as well. And I guess I want to kind of make sure that we're trying to build these communities and work with the local voluntary care sector, but also local businesses and local organizations to build that community from the ground up. And to it's all about co-production and co-design, like you know, Nina and Jill and all of you actually have mentioned that term, and I wanted to use it as well because there's a secret there.
Yeah, thank you. I think that's a really, really key point. And it seems to be something that everyone's echoed. It is that collaboration. It's that everyone working together, because it's not just going to come from one area. It's collaboration that will be really important. I'd actually like to come back to you on one point. So how do you think kind of we as the leisure, sport, physical activity sector can work better with the health sector to kind of support this change?
Yeah, so that's something that I really wish kind of I had like a perfect solution, like a one sentence kind of, you know, perfectly sort everything out. But I think there's like a series of answers and a series of actions that we all need to take. And I often kind of refer to this kind of like 360-degree approach that I like to mention. So we all kind of play a role, and we're good at pointing fingers and saying what's not working and what's good and what's bad. But first angle, I think it's for me, it's the future doctors, the future generation, and the clinicians themselves, I guess. So start with the root of the problem, teach the future generation of doctors about population health, involve them in these community activities by allowing them to join such placements in school, or showing them what the younger generation is getting from physical activity by joining the community activities you've designed. And then, you know, and then also then we move on to the current doctors. But how can we expect our current doctors to know this if we never taught them about this? In terms of current doctors, I guess more importantly, we need to make time for personalized care and for discussions like this, and not just do a wishy-washy chat, oh yeah, you've been told about physical activity, make sure you do it, kind of telling them that they should do it, which we know it doesn't work. And then I think the next angle, so the third angle, would be the local communities, the voluntary care sector organizations, which we need to engage more with local, you know, they also need to kind of engage more with local universities, maybe medical schools, to kind of bridge that gap in between, offer students the opportunity to join these placements as well, but also, you know, the volunteer care sector has the opportunity to provide these activities in the local areas as well. And as I said, it could be a bi-directional kind of like learning opportunity for the students, but also for the placement providers. Which now I'm talking about, you know, what the voluntary care sector should do, but it brings me to the fourth kind of angle, which is the government. You know, you can't, or, you know, investing in kind of the business side, we can't do these activities unless there's proper adequate funding, and at least unless these problems are being seen as a big priority, as, you know, we see other acute issues, because long-term change can only happen if we start somewhere, and the government needs to understand that. And my final point is just to complete that kind of like 360-degree kind of like approach kind of angle. I think we need to also talk about patients and the general public, especially if we're talking about the younger generation. We need to make sure we don't underestimate the untapped potential of the younger generation and their kind of like joy of being part of something bigger and getting involved in their own health. We need to shift that kind of culture of I'm telling you what to do to you can also take care of your kind of some of the things that are harming yourself, and you can also care and look after yourself by choosing healthy options for food or exercising regularly. But we need to change that culture. So I'm a big believer that in working together with patients and raising awareness amongst the general public and equipping them with the necessary tools to look after their own health when they're able to do so. Of course, I'm not talking about moments when we need it. I think that would be a great tool to help them in a way as well. This bit links very well with the project that I did at Harvard when I went to do the fellowship there, and we tried to redesign healthcare systems across the world. And what we found was that truthfully, the population keeps going up, the number of people will be going up, and the number of doctors stays the same. So if the population goes up, number of people stays the same, you'll have a massive gap in between that eventually you will not be able to fill unless you kind of change your approach. Now, that change of approach, I think, is preventing disease from occurring and meeting patients halfway through and preventing these chronic diseases before they become a problem. So I think for the future, patient engagement groups, patients as leaders and champions and championing different activities will be key within local communities. And we know that setting up healthy communities leads to healthy people living in them. And we've got countless examples from Bromley by Bow to running groups over the weekend to exactly what you've described, Laura and Jill and Nina, which are brilliant activities to get involved in.
That's great, thank you, Bogdan. I think that's a really, really important point as well, as kind of giving young people a little bit more credence and a little bit more trust in terms of they do know what's good for them, and kind of giving them a bit more responsibility in deciding that, which I think is really important. It'd be great to come back to Nina kind of on that strong kind of, I guess, community side of things and communities feeling ownership of their local spaces. So I'd love to kind of hear a little bit more about you, from you, sorry, about whether you think it's important that kind of local communities feel ownership of their local spaces, and also around how you've encouraged that local community and family engagement with the Olympic Park.
Yeah, sure. I think it's kind of build on the point I was making last time actually about how I guess actually as LLDC or the Olympic Legacy, we're often like one removed from the local community. So for us as I guess the region organisation and the funders, it's really important that we're connected in with the groups that are connected to the people that we're not connected to. I mean, how many times can you say we're connected there? But I guess what the point I'm trying to make is that for us, it's incredibly important to have our key community links. And I mentioned earlier the likes, an example that we often talk about is Value Sports, who work predominantly across Hackney and searching out into kind of further into East London. But their role and our connection and working with them is incredibly important to keep us in tune with what the local young people are saying. So they often, and the way that Nana, the founder, would describe the people he works with, are people that I guess on the risk of becoming disenfranchised from local communities. So our role within that is where there is a slight lack of like distrust with the local authority and distrust with schools and from bad experiences, and where the young people they're working with don't feel they've got a connection to the place, is how we use the park and the assets and the programmings that we're running to give them a sense of purpose. An example is that Nana had approached us about a group of young women, so they were aware there was loads of activity going on for young boys, so lots of like football clubs and just stuff happening that he would be helping them create. And this group of young girls were saying that they were really worried about getting involved in, I guess, drug lording and getting involved with kind of chip shop recruitment, so that they're hanging around after school, they've got nothing really to get involved with. So it's really, they were really frightened that actually their outlet would become getting involved with the local drug scene and gang scene. And he was, one of the young women approached him and said, look, we just want a place to play netball, like I'd really like to set it up. And I think our role in that is how, as a person that's got access to space and as a funder, can you help put things in place really quickly? We had a really short window of engagement. So Nana was like, if this isn't kind of up and running within the next couple of weeks, we're going to absolutely lose kind of the interaction and the relevance to this group of young people. To help them, and our role in that was a bit of seed funding, so money and access to one of the schools, and the netball club is up and running. They now have kind of over 50 sessions with these young people, and it's kind of spread widely. But I think so how, yeah, kind of you react to local need and know our role within that. So our role within that as LLDC would definitely not have been direct interaction with the young people, because they don't identify with us in that sense. But our role within that was, how do we support an organisation that has access to people, and how do we use the assets that we've got? And then also, I guess that's around creating a programme. But then on the other hand, like, we just have an asset of green space, and how do we use that? How do we encourage people just to use that on their own free will? Like, we have kind of the parklands, we have the play parks, and one of the things we always talk about actually is, I don't know how many people know the Olympic Park that well, but just below the stadium as you come over from the Aquatic Centre, there are some water fountains on the floor, and there were many discussions about whether they should be included as part of the public realm there, and whether the investment was worth it, because it had changed the budget slightly. But actually it doesn't have to be a sunny day, on any day of the week that those fountains are on, and people are just there absolutely enjoying the space and finding it as, I guess, a safe place to hang out. They know there's an accessible toilet nearby, they know kind of there's flat floor space, they know they can sit down and have a picnic. And I think it's about how we also encourage people just to use the green space and take ownership over it as their own kind of community space. And you do start to see, the more that we work with some of the local groups, that the different people that just turn up on a Sunday and have a picnic with their family for free, and they know there's a park, and they know there's a toilet nearby, is just increasing massively. And we've seen that change over the last 5 years as new communities are moving into the area. And then we're still trying to do a lot of work around how we make it easier for groups that want to programme activity to use the park. And I guess there's always work to be done with the local authorities around that, and often it's always a kind of free of charge for our local communities. But like everything, we try to make sure that the paperwork isn't too bureaucratic and that turns people off, and there's obviously still work to be done around that. But I think mainly for us it's about kind of how we use the space to react to local need. We've got great assets in terms of the waterways and the canal, so we're working with the likes of the Canal and Rivers Trust to make sure that people think that coming along the canals is a safe route. So I don't know again how well people know East London, but for context, we've got lovely Regent's Canal and the Lee Valley River, and that's a beautiful part. There's lots of great food and beverage offers, that's kind of well lit, and it's really well used. And then slightly off to the other side, further north as you go east, is another part of the canal that goes past the Kingsmead Estate and up into Hackney, and people tell us that they feel less safe along that, because there's, I guess, less maintenance that happens. The council don't cut the trees back as much, there's less lighting, and we're trying to work with the local communities around that area to ensure that the routes in and out the park as well are easily accessible. And another example, we know that from Waltham Forest it's less of a nice walk in, because you have to come over the A13 and there's a big main road there. But how do we use kind of wayfinding and routes and our kind of local feedback to make sure the park is a lot more easily accessible. But so I hope that gives you an idea. So there's a couple of things that we try and do around actually like reactive programming with local groups, and the point I emphasise is that we definitely as a first response aren't the right people, but through our engagement and our connections and funding with the groups hopefully can offer space and opportunities. And then yeah, kind of how we just use the park as a green space to make sure it's safe for people to use and they can just rock up. But yeah, I think hopefully that gives you a bit more of an understanding in terms of how we operate with local people. But as I say, it is about, yeah, kind of us being quick reactors to responding to opportunities.
Thank you, Nina. That all makes complete sense. And I think that's a really important point as well around not necessarily doing the work somewhere that you know somewhere else would be better. So working with those community groups because you know they have the connections and they're probably better connected to the local community themselves, and just supporting them to do the work, which is, I think, yeah, really, really valuable. Oh, did you want to come back in?
As I say, we just saw during COVID actually an example, and again using the Buddy Sports and the Bike Works example, just how those communities responded to what was happening locally. So often they would be delivering on the park and running activities for us, and obviously and directly, I guess, for young people. These young people suddenly didn't have a school to be going to. They were just, you know, the term had stopped and there was nothing for them to be doing. A lot of the families they were working with didn't have access to food. There was this kind of relationship that we were trying to create between the local authority and them, and some distrust happening. But so Buddy Sports and we supported them to entirely change their business model. They then were running a food bank for the local area. They were reaching over kind of 2,000 local people. They had their young people out volunteering as something to do, as not being part of the school day, and again with Bike Works. And what we did during that period as their funders, I guess, is just allow that flexibility in the approach to what they were doing. That I know a lot of people, thankfully, were helped massively. So Bike Works had changed a lot of, rather than bringing people, and often people with disabilities, to the park to take part in an all-ability cycling club. They were using their cycling coaches and some of the people that they engage with to deliver essential items and prescriptions across East London. They delivered over 12,000 prescriptions in the first 12 months to people in need. And this was, again, working with people with disabilities and their cycling coaches to get those out being active. And it was just amazing to see how quickly these people that are literally at the centre of their communities were able to adapt what they were doing to still engage, but just in a different way. So it wasn't necessarily through delivery of sport, but it was using kind of activity and sport and active travel as a way of either, yeah, kind of connecting people that didn't have support, or using kind of their young people as a way of doing something. But yeah, so yeah, it's just amazing kind of how, yeah, great the people that we work with are, and yeah, we wouldn't be doing what we're doing without them, for sure.
Yeah, I think that's great, and that flexible approach is really important. Laura, I think you've got your hand up there.
Yeah, just for the sort of the Olympic Park's wider reach, obviously we're completely the other side of London. But for all the events they put on, whether it be England hockey, the table tennis, Nike did an awesome event at the beginning of the year. And for us, it is a good an hour and 20 minutes from school to the Olympic Park. But to get there and to be there, and for the experience of the children, one, for an Olympic sporting venue is amazing. Just the fact they get to see it and walk on it has such a power that it encourages them and inspires to go, oh, okay, I could do this, and to see the events. But we always, you talked about the water fountains. We did, Nike was a horrific weather day of thunder and lightning, and the water fountains were on. And I had 20 children just going, go on, let us go, let us go. And every time we do a trip, we have to put a 45-minute window in of play, because they love the climbing wall, they love the sand pit, they love just that whole experience of look at the space they've got, look what they can do. And it's lovely for the children to then go back home and go, Miss T's taught us how to get there. Like, we know we get on the central line and we go all the way to the end and we get off. And the parents are like, okay. And for the legacy games that you always have been doing in July, we're lucky enough to try and get tickets for that through whichever way possible, to take 50 children and parents, and just to see that accessibility that, okay, it's a train ride away, but look what you can do. Like you said, you can spend the day there. as broadly as you want to, whether you go shopping beforehand and then pop across the road, or the family splits. There's the opportunity to do something for everybody, and they've loved it. And sort of the praise they get back when they come back in September is like, oh, we went in the summer, we did this, we did that, we met up with this family, that family. And it's just that knock-on effect of giving them the confidence to know what's outside of their own local bubble, that there is so much more to do. Even for us in Ealing, that there's certain parks to go to that they know are there, they've never been. Like, oh, we don't know how to get there. It's like, just jump on the bus. Like, it's right, from outside of school straight there. And so it's, sometimes it is us giving them I'll take you on the bus and then we'll show you a trip and off you go. And it's been a really powerful tool of just that, give them the opportunity to do it, rather than, okay, we're going to do it now and then that's it, it's a one-off. They don't, give them the confidence and they'll just keep going, which is really good to see. Sorry.
No, that's great. I completely agree with you. And I think that's also a really kind of key point around, not everything will work for everyone. So it's about having that offer that kind of encompasses everything. So if someone wants to do something, they have the option, and then the other people have the option to do something else. So it's that flexibility, I think, that Nina was talking about as well. It'd be great to come to Jill just around kind of the outcomes that you found from maybe the Families Fund projects, because I know there's a huge variety going on in terms of engaging families, and any kind of key takeaways there that you think would be beneficial.
Oh, sure. Well, our insight tells us that children are more likely to prioritise being active later in life if the parents are active. So we also know that benefits to a child's development are different when they're active with adult family members than when they're active with their peers. Children can also play a role in encouraging their parents to be active through pester power, so it can work the other way too. Our latest Families Fund data is beginning to show insights now into how families being active together can impact on wider social outcomes. So Dr. Bogdan's referenced mental well-being. Well, more than 60% of adults who've increased their activity levels through our Families Fund projects have also reported improved life satisfaction, and about half reduced levels of anxiety. 61% of adults and 41% of young people whose activity levels had improved also reported higher levels of happiness. We've also seen impacts on social trust. Both adults and young people who'd increased their activity levels as a result of taking part as a family demonstrated improved levels of social trust. In adults, this manifests itself as trust in their local neighbourhood, but for young people, increased trust of other youths.
That's great, thank you, Jill. There's a lot of food for thought there. We've just got a couple of questions, and then I think we'll probably wrap up the session. But thank you all so much for joining us. So the first question is from Daryl, and it is, why are most solutions available today structured, sport, exercise-based, and usually with parents or other adult involvement, rather than the unstructured free play and enabling environments to encourage free-range children like many of us had in the past? Would anyone like to come in on that one? So looking more at kind of play versus structured physical activity and why we think that's changed. Yeah, Laura, jump in.
Yeah, I think the idea of sort of using those free spaces for us was giving the sense of safety and being together. And for us, we thought children were going home and they're not doing anything, but there are actually so many other things that children will go home and do, whether it be tutoring or religious studies. We realised the children weren't going home to actually relax, as it were, till 8, 9 o'clock. And then by the time you've got dinner, done some form of work, if they were doing homework or spellings or times tables, that was it, the window was gone. So for us, having it directly after school, we really did just we created our own park, basically. And I think that had a better impact of rather, okay, you play with this, you play with that, and controlling it. Whereas we literally opened a bag of stuff, the parents sat down and chatted, and the kids played as they would as a park. And it definitely had a better social standing rather than maybe an after school club where it was more directed of the sport. For us as a community, our parents aren't always keen on those children going out for the free play based on the times that they potentially would be free. So by doing it after school, it just hopefully gave a little bit of security and space, but free reign to do what they wanted and play and learn through that. I hope that's the same.
Yeah, definitely. I think that also kind of comes into looking at things like those mini active cities and things like the Olympic Park, and just encouraging more opportunities for children and their families to actually be active together in whatever way they like. Just having those spaces, I think, is a really, really key step in the right direction, definitely. Would anyone else like to come in, or should I move? Jamie, yeah, go for it.
I just going to, I suppose the question's a really fair one, and it sort of exposes the limitations of our community investment model, which is, and I'm sure this is, you know, of a piece across the sector. When we put money into things, we want to know what comes out of it. We want to evaluate it and understand what the impact is. And without that, it's really difficult to make a business case with our respective organisations to justify the investment. When you're looking at things like free play, and we do fund some organisations that do this, but it's much harder to understand what you got for the money, which sounds like a really reductive approach, but bear in mind that we work in large corporate organisations where a business case needs to be made. If you've got something which is very nebulous and loose and clearly a benefit but you can't measure it, it's really difficult to do that.
Yeah, I think that's a really important point, and maybe that's something that needs to be looked at in more detail, how we quantify that and show the benefits of that for both businesses and those involved. So I think that's definitely food for thought. One of the other questions we've received is, why do we feel that the promised legacy of increased physical activity post-London 2012 didn't happen, even with all of the publications and awareness around the time of sitting being the new smoking? So I guess looking at the Olympic legacy and maybe why we think it didn't have as huge of an impact as we'd hoped, or whether we agree with that. Would anyone like to jump in on that?
I guess I can start, naturally. But I guess it's hard to say, isn't it? That question always comes up, and I think for us is about how do you measure impact and success of a games and actually what that means. And you can do that in a couple of different ways. You can do it by looking at, I guess, how the venues are used as one option. So we know that we're one of the few games actually has a fully functioning stadium post-use that actually has community access to. The fact that 9,000 kids a year can access the stadium, get involved with free sport, free stuff that Laura's mentioned, like the anniversary games and other activities that we put on. I think that in itself is a major success. I don't think that happens at any other Olympic stadium across the world. The fact that we will have eventually in 4 years' time 60,000 university students as having the Olympic Park as their university campus, again, is an incredible success. I think that maybe the question's looking at why did it not increase physical activity as such. So prior to myself joining, I know that there was a huge programme, and I referenced at the beginning, around just getting people active, so active parks, and that took place across London, just about getting people to be actively involved in their local area. That was a massive success, that project, and I didn't personally work on it, colleagues before myself did, but that got 160,000 people active in their local parks. I think that number kind of doubled the expectation of what they were hoping to reach during that 4-year project, which is amazing. And we know from just the stats that we have, the thousands of people that use the park as a cycle route each day for active travel, kind of the hundreds and thousands of runners that we have there every year. I think them using the park as an asset for activity definitely shows it's a success. I think it's harder, and like Bogdan and some of the others have began to reference today, like how you articulate kind of physical activity increase as a nation is probably quite difficult to actually manipulate into data. And like James said, I think that's why it's really important around why we do, I guess, capture data around programmed activities, and why we do look at who's taking part in physical activity. But we know we get 1 million users through the doors of the Aquatic Centre each year, and 90% of them are from kind of the 4 surrounding boroughs. I think that stat in itself is incredible. But I do agree that it's really hard to look at, I guess, general activity rates across the UK and comment on whether the 2012 Olympics actually had an impact on that. But I would say in terms of East London and what is brought to the area and the activities that we see, it's been what I would say that it's been an incredible success, and the opportunities that it's provided for local people, because people see the impact of creating this new piece of city in the east. The fact that, I don't know if many people are aware, but we've got East Bank, which is kind of creating a new cultural district in East London. So we've got some world-class organisations coming. So UCL are building their new campus on the Olympic Park. Sadler's Wells are bringing their theatres across. The London College of Fashion are moving their whole institution across the park, BBC Music. And I think just the spotlight the Olympics created around what the opportunities that exist in East London are and what they're going to be is incredible. And I think that in itself is a massive success.
Yeah, that's great. Thanks, Nina. Laura, do you want to?
Sorry.
Bogdan? Yeah, no, go for it.
Laura, do you want to jump in first, or? Fabulous. So I loved that question. As soon as I saw it on the chat, I started smiling because it's a great point, actually. I think that the deeper kind of like question there is, you have all these publications, all this, the facts, the evidence base behind physical activity, it's working. Why do we still see an increase in obesity, and why do we still see these rates? And that's the conundrum here. That's the paradox. As I said, we know it's common sense. So the issue is we're at risk of neglecting it. So the whole problem is the culture again around it. And I think it starts very early. It starts from school. It starts from how we look at food, how we look at things that we do usually with our families, but it also has to do a lot with social determinants of health. So the biggest umbrella here is social determinants of health, and we know that our health is influenced in part. 80% of our health is not influenced by biology, and that's just 20%. Our health depends 80% on social determinants of health, including housing, education, lifestyle, and all those other things, which Michael Marmot put together a great kind of like review of a while ago, and he's the kind of like the father of social determinants of health. So unless we change that way in which we educate others and talk more openly and kind of like better, like develop better techniques of getting people to become more active and understanding what do we really mean by looking after yourself and being purposeful about that, then nothing will really change. And Daryl's had that, a great thought. Even the previous question as well was why can't we let children play as we used to do in the past? And again, that's because the world is changing. We're digitalizing everything. We've got like PlayStations and different kind of types of games. So it's kind of like the culture is changing. So we also have to change with it. But we need to emphasize and make use of the data that kind of we have available. But it's within our part to do so. And finally, I just wanted to say that I love the questions that are coming through as well. And if we don't manage to kind of answer every single question, we'd love to kind of connect with you all. And if anyone has anything they'd like to do with medical students, younger generation, or anything of that sort, get in touch. I'd love to hear your thoughts. My Twitter is @Bogdan, so BOGDN, BCG, or my email. I'm sure Will can provide that after, but we'd love to get some students involved in some of the activities that you're all doing.
Great, thank you, Bogdan. Laura, did you want to come in quickly? No? Okay, Beryl. Well, thank you all so much. I think it's been a great session, definitely some food for thought there. It'd be great to just end on a very quick kind of key takeaway from all of you. Just one sentence or a few words or whatever you think is your kind of key message from the session. Yeah, I'm happy to start with Laura.
Yeah, I think Jill spoke about fun, whether it be engaging or the parent or the children. An old friend once said, if every adult knew one game to play, no one would ever be bored, because every different adult you would meet would teach you their new game. And I think that activity and that idea and that passion of being active and that role model there, I think is key. Just show them it can be done. It doesn't matter how they do it. They just make their own fun and it will always work.
That's great. Jamie?
I think the big thing for me, and I think it's a challenge for the housing sector, and it's picking up on one of Bogdan's points really, which is how we as anchor organisations within a community link in with other organisations, including PCTs and other health structures, to provide us a much more integrated care offer. I think that's something that we have a really valuable role to play in, but I don't yet see it happening in a meaningful way.
Okay, great. Thank you, Jamie. Nina?
Hey, I think for us from the park perspective, it's just about how we encourage people to connect to their green space and know that it's open and accessible for them. I think we as a place and as people within our department are really passionate about local people using it, and it's how we provide opportunities and make it a lot easier for people to do things. So the fear of paperwork and the fear of just getting active isn't a barrier, and we're desperately trying to make sure that that happens in the next few years.
Great, thanks, Nina. Jill?
Yeah, I would say the key takeaway would be that all families are not a homogenous group and every family is unique. So really understanding the families that you're targeting is essential. Building trust and relationships has come forward as well from our projects as one of the key aspects to consider if you're wanting to work with families.
Perfect, thank you, Jill. And finally, Bogdan?
Yeah, so I think you're already anticipating this, but for me, it's the same word all over and over again. So education, education, education for schools, students, clinicians, patients, general public. And we need to basically ensure that the future generation of doctors is trained to work together with a patient, meet them halfway, and ensure they stay active to prevent disease from occurring in the first place. As for communities, healthy communities, healthy people, we need to make sure that we decrease the resistance that people kind of feel in taking healthier habits as well.
That's great, thank you. Well, thank you all to the panelists.